Let's talk about spinal tumors. So did you know that you can have tumors in your spinal canal or spinal cord? Yes, not all tumors happen in the brain. So what are spinal tumors? Now we have to understand the anatomy of a spine to understand these tumors. In the spine, we have the bony canal, that means the bone is there which protects the spinal cord. Then there's something called a dura mater, which is like a protective sheath which actually gives protection to the spinal cord, and then you have the spinal cord. Now if a tumor is between the bone and the dura mater, it's called an extradural tumor, that means outside the dura. If the tumor is between the dura mater and the spinal cord, it's called an intradural-Extramedullary, that means inside the dura mater but outside the spinal cord. And if the tumor is inside the spinal cord, it's called an intramedullary tumor. How are these tumors present? Now the tumor presentation may depend where is the tumor, which location and which type of tumor it is. Typically, if it's in your neck or in your back, you can have weakness in your hands, weakness in your legs, difficulty walking, difficulty passing urine. Tumors outside the bone, outside extradural tumors are normally either because of infection, either can be because of a fracture, or they can be because of some sort of malignancy or cancer which has spread to the bone from somewhere else. Tumors which are intradural-extramedullary are generally of two major types. One is called a schwannoma, basically a tumor which comes from the covering of the nerve, and one tumor which comes from the dura mater itself. Both of the tumors are very non-cancerous and normally in most cases quite easy to treat. The most complex tumors are which are from inside the spinal cord. Now these tumors are complex because they're sitting deep inside the spinal cord. They normally require a complex surgery to remove, may carry a risk of having more problems worsening after surgery, and do require a very complex and a long procedure to remove them. And these can be again non-cancerous tumors or cancerous tumors. So today we learned that tumors can affect our spinal cord and not only our brain. Thank you.